Thank you for tuning into Eye on Health here on Dubai Eye 103.8, brought to you by Arab Health and MedLab Middle East. I'm Helen Farmer, and this week we are going to be discussing Population Health and Femtech. The term Femtech describes technology, products, services and companies that specifically focus on women's healthcare needs. But just how much is the Femtech industry impacting women's healthcare now and hopes for the future too? Joining us now, a woman in the know. And who better to start the discussion with than the fantastic Dr. Samina Dornan, consultant maternal and fetal medicine specialist, plus OBGYN at Al Zahra Hospital, Dubai. Has it been a busy start to the year, Dr. Dornan?
Always is. Good morning, everyone. So nice to be here again. And yes, it is always a busy start. One thing is for sure, an obstetrician is never going to be out of business, whether it is COVID or whether it is whatever it is,
You're absolutely right. Can I ask you, how do you feel like we have evolved when it comes to attitudes and conversations around women's health over the last few decades?
Do you know, I sometimes give a call, and I love this question that you have asked me. And my late husband, Professor Jim Dornan, used to show this picture of a woman. There was, a figure with no head and a figure with a head. And, it used to say a woman of 1960 and a woman of 2000, and a woman with a head is a woman in 2000. And what he used to say, and I honestly love that, and everyone should recognize that in 2000 or after that, people have for the first time realized that women do have an organ above the neck which is called brain. So empower them, let them make their own decisions. And I think we are moving there. Are we there? Totally, not really. Mm-hmm. Are we there totally, even in a developed world? Not at all. Mm-hmm. Women care is still driven by economy, but I would like women to empower themselves to have the knowledge so they can stand for what they want.
Absolutely. So can I ask you then, what is keeping you busy? What are some of the main issues? And let's maybe move away from the baby delivery. As you said, this is very much the kind of the bread and butter. But when it comes to common health issues that you're seeing from women in the UAE.
There is a wonderful Pakistani artist who used to paint the hidden self. That woman is never what she wants to be. Mm. She's always trying to be the best daughter, the best wife, the best daughter-in-law, or a best friend. Whatever people are telling her, you need to do this, she feels she needs to do that. Mm. So when women come to my clinic, no matter what the problem is, they always talk about what my friend said, don't get a Mirena coil, which is intrauterine contraceptive device, because she suffered that and this. And I just feel women are not studying deeply into problems themselves. They are very colored by other people's experience.
That's interesting. We think about this kind of one size fits all, or that worked for her, so it must work for me, or she hated it, so I'd have a bad experience, and we're not necessarily listening to our own bodies enough.
You have said it so well. One size doesn't fit all. Women should realize that every woman is unique.
Absolutely right. And in terms of, is anything on the rise in terms of women's health problems you're seeing in the UAE? Are there any cause for concern with specific issues?
Yes, I think one of the biggest things on the rise is, I would love for the government to address it, the insurance companies' rules and regulations about the testings and medications for women and prenatal testing. Things needs to be updated. The prenatal testings are changing. Science is changing. Mm-hmm. So everything is changing. And I think we need to change with that.
We recently discussed menopause and actually how so much is still unknown, and actually how there's a huge gap in doctors' training in this area, despite the fact that every woman listening today will go through menopause or has already done that. What about pregnancy? Do you still feel like there's any myths or misconceptions floating around that you'd like to address with us?
Well, pregnancy, one of the biggest thing with the pregnancy, women are labeled, you are low risk or you are high risk. But as far as, labeling people that you are low or high risk, not necessarily is true. A low risk pregnancy is a low risk pregnancy when your child starts going to the primary school and starts achieving its milestones, then you look back on that pregnancy and you can say, oh yes, I was a low risk pregnancy. So please consider every pregnancy as an unknown journey, and take one step at a time, and try not to plan your whole pregnancy and pregnancy plans that I don't want this and I do want this and this. Take one step at a time, because the bigger the plan you make, and when it doesn't happen according to that, you feel depressed about it, you feel unable, you feel not enough of a woman, and depression comes in.
I thank you for saying that. I mean, I know an awful lot of friends who've done exactly as you said, with the best of intentions and wanting to have a sense of empowerment or control over pregnancy and birth, and sometimes quite elaborate birth plans, only for things not to happen the way they'd hoped. And it's almost like a grief, it's almost like, and it can overshadow, what can and hopefully is, a really beautiful start.
Yeah, and I would love to tell women that normal delivery is a healthy mother and a healthy baby. It is nothing to do with it. Normal delivery has to be a vaginal delivery, or has to be this, or has to be that. A normal delivery in this day and age is a healthy mother and a healthy baby. Whether it ends up with a cesarean section, whether it ends up with a forceps delivery, or what we call it instrumental delivery, or vaginal birth, it's okay. None of these. So please, and people feel very, women don't feel complete if they are unable to breastfeed sometime. They feel psychologically very damaged. Don't feel that. It's not something which is necessarily in every woman's power. All the hospitals and the doctors and the midwives can do to give you a support. But if it doesn't happen, it's not the end of the world. Look, I am the child of the 60s, right? In the 60s, it wasn't fashionable to breastfeed the babies. So, I haven't done so bad.
You're doing all right, Doctor. You're doing all right. What about having women having babies at a kind of a later age? And I guess two parts to this question. One is, why do you think that might be? And secondly, when should women think about perhaps freezing their eggs if they do want to have the option to give birth, later in life?
Well, I have a news for you. If you read the medical books, okay, and if you haven't had your first child by the age of 28, you are called elderly primi gravida.
Oh, that's so depressing.
So based on that, I suppose majority of the working women has already lost that battle. So the ideal, look, the fertility starts going down from your late 20s or early 30s. Okay, that is a scientific fact. And it becomes rapidly starts going down after the age of 34 and quite rapidly after the age of 40. So the best age to have babies is in your late 20s, okay? But now we are having more, we are professionals, we want to do things, and it is not really possible for a lot of us to have children so early. So it is okay. You can freeze your eggs, and the best times are usually as early as possible, but definitely between 27 to 34 years of life. And it doesn't mean that after 34 your eggs are not good, but for some it won't be, but for others it still can be okay. So if you are after the age of 34 and you are listening to me, it's not the end of life. You still can freeze your eggs. The quality can still be okay.
What about even into 40s or 50s? Janet Jackson giving birth at 50. When we think about the impact of the age of the eggs, what complications can that cause? Just so everyone has the information, Doctor.
It is hard to get pregnant after the age of 45 naturally. But of course, you can get pregnant with assisted reproduction techniques. And then it depends whether it is your own egg or was it that egg which was frozen at earlier age. So there is the chances of a baby's abnormalities are much less. Remember, the age of the father also matters. Yeah, there are chromosomal abnormalities which are also associated if the father is older. So older sperms can also have abnormalities. It's not just women. So we must not keep this discussion in this century just focused on women's age,
Absolutely.
but also father's age as well. Ideally, look, you know, and I know, and everybody else know that when we go over the age of 40, we naturally have more health problems, pregnant or not pregnant, right?
Mm-hmm.
So pregnancy becomes more complicated because you have more health problems, blood pressures, diabetes, weight gain, all these issues. So best to have them early. But the oldest lady I delivered was 56.
Wow.
But she was IVF. And she was with donor egg. Her husband was, I think, 65. So it is possible, but that it gives empowerment to a woman. But also remember, statistically, you are not going to live that longer. Yeah.
Mm-hmm.
So think about the children that you would leave them without parents.
Absolutely. I wanted to end, Dr. Dornan, by asking you about gender bias in healthcare. Do you feel like there is, more research, more funding, more interest in men's health? Or I guess what I'm really saying is, if men had periods and they were giving birth, would it be a bit easier?
The answer could be yes, and the answer could be no. I don't want to, corner men all the time. I think it is also depends on women. Are they speaking up or they are just listening? And as I went back to what I started with, we are more listeners. We are not talking. We are not shouting. Yeah, we need to talk more. We need to say more. We need to tell more what we want. If you are not asking, that how is the other side going to know what you need?
It's interesting, isn't it? The squeaky wheel gets the grease and all of that. But I think I hope that women are becoming a lot more involved and informed and confident to go to a doctor and say, this is how I'm feeling, this is what I need. How can you help with that? Maybe that power balance has shifted a little bit because we've got access to more information. But as you say, we do need to keep speaking up, because it's only in the last couple of decades we've started to see, drug trials actually done on women, or that's.
Also, things have changed a little bit by bringing, husbands and partners to the, labor ward and to theatre, being there and watching what a woman goes through. That has also changed a bit of a perception. Mm-hmm. So, which is a good thing. It has also increased our burden as a healthcare as well, because we have to then deal with a partner or husband as well. Sometimes, they get faint and they can't cope with it, or they interfere unnecessarily. That has its own problems. But I think from a benefit point of view, they also then realize what a woman goes through, which is a nice, positive thing.
Absolutely. Go through together as a family. Dr. Dornan, thank you so much for your time. Are you going into surgery this afternoon? Is there going to be another addition to the Dubai population in the next 24 hours?
Always.
Thank you so much. Really appreciate your time. Dr. Samina Dornan, consultant, maternal and fetal medicine and OBGYN at Al Zahra Hospital. Up next, we are going to be talking to specialists in gynecology and continuing the conversation here on Eye on Health around femtech and women's health.
You're listening to Eye on Health.